Hello and welcome to Call to Mind Live, Pass or Fail, Mental Health in Community Colleges. I'm Scott Tong, co-host of Here and Now from NPR and WBUR Boston. Tonight's program is a co-production between WBUR and Call to Mind. That's an initiative from American Public Media to bring new conversations about mental health. Our event is supported by the PBS NewsHour Student Reporting Labs and the Wellbeing's Youth Mental Health Project and Tour. Wellbeing's is a national mental health initiative led by public television and radio station WETA in Washington, D.C. Now, before we dive into this big topic, here's a little bit more info on Call to Mind and the Wellbeing's Tour.
WETA, with a coalition of partners, welcomes you to the Wellbeing's Youth Mental Health Project. Hi, I'm Bill Pullman, and I'm honored to be with you as we launch this national campaign from public media. Wellbeing's is a groundbreaking project at a very important point in time. Mental illness disproportionately affects our young people and the most disadvantaged populations among us. The growing mental health movement has set the stage for dramatic change, to raise awareness, to reduce stigma, to focus on prevention and early intervention, and the promise of more research for new treatments. Together, we can bring mental illness and discrimination out of the shadows, and it's not a day too soon. So thank you for being here today.
The signature documentary series in the Wellbeing's campaign is Ken Burns Presents Hiding in Plain Sight, Youth Mental Illness, produced and directed by Ewers Brothers Productions and written by David Blistein. The film will explore through lived experiences the youth mental health crisis in our country. Currently in production, this 4-hour documentary film will air on PBS stations in spring 2022.
Wellbeings.org and #Wellbeings will be adding new content every week, including
Brave Teens, a digital feature-length documentary that offers a candid portrait of the lives of teens who have decided it's time to talk about their mental health challenges, to support one another, and to end stigma.
Out of the Dark, a short-form digital series that profiles the stories of 3 young people who faced the greatest mental health challenge of their lives and found strength they never knew they had.
Little actions make a big difference. A new animated series shares easy-to-use, science-based tools, actions, and tactics to support your social-emotional health and well-being.
And Tell My Story, a digital documentary in which a grieving father seeks answers after his 14-year-old son dies by suicide. He uncovers painful truths about the lives of teens, the impact of social media, and the shocking rise of depression among America's youth.
PBS NewsHour Student Reporting Labs engage high school journalism students as correspondents that report on youth mental health for more than 150 high schools across 46 states.
Mental health affects all of us. We all experience various levels of mental health and well-being through our lifetime. According to the CDC, half of us will experience a mental illness at some point in our lives. Call to Mind's goal is to bring this topic out into the open, to get people talking, to increase understanding, and using all of our media platforms, news, shows, live events, podcasts. We are engaging the American public in a conversation about mental health.
If you're here, it may be because you've seen the headlines about a mental health crisis or emergency facing young people in this country, particularly during this pandemic. So tonight we take this head on. We specifically focus on a large, critical, and often invisible segment in America, and that's students in community college. We're going to ask, who are these students and what are their mental health challenges? What are their life challenges? How does it fit into a broader national issue? And how is the pandemic affecting these students' well-being? What do we know about the causes of mental health diagnoses and what do we not know? What are the solutions and whose job is it to help? Coming up, I'll talk to the U.S. Surgeon General, Dr. Vivek Murthy. He's been very vocal about this issue. It's very personal to him. But first, let's hear directly from some of these students.
Hi, my name is Celine Mendoza. I am a second-generation Hispanic and a first-generation student coming from Northern Essex Community College.
My name is Sarah. I am 38 years old.
Hi, my name is Julia Vogel. I go to Bunker Hill Community College and my major is psychology.
Hi, I'm Beth Evans. I went to community college in the general Chicagoland area. I have depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder, and an eating disorder, anorexia.
In the past year, I was actually diagnosed with bipolar 2, mood disorder.
I have OCD, chronic depression, and generalized anxiety.
When I first got ill when I was 16, I was misdiagnosed with a type of schizophrenia, but a few months ago I was re-diagnosed with a rare type of PTSD.
The pandemic made school so much harder because I didn't get to practice my socializing. I know that probably sounds weird, but being in a social situation throughout my ups and lows really did help because I was able to kind of understand, like, this is how I'm feeling on my ups when I'm talking to somebody, and this is how I'm feeling on my lows.
I feel like I'm stigmatized because people don't always know my diagnoses, but they might notice that I'm doing things differently or strangely. I had a couple teachers that would just be very short with me, or I had come to them telling them I was having a hard time or I would need a little extra time to do things, and just they would treat me differently.
Earlier in life, nobody made a big deal about it, but I've always been open about it and not ashamed about it. But and now people can be so mean and cruel and say mean things about both my old diagnosis and my new diagnosis. And I don't feel ashamed of having my illness. I feel like other people are unfairly shaming and discriminating against me.
I had written an essay for one of my English classes about my issues with depression, and I tried really hard to make it personal and exploratory, which also tied into the assignment. And my professor took me aside afterward and said, "Don't write about these sorts of things. That's way too personal. No one wants to read this. Talk about it with a doctor. Don't turn this into class. Write something else." I was heartbroken. I was really embarrassed because I felt like I put my heart on the line and took a risk. And it was just a reminder, I guess, that I felt different and that I wasn't fitting in. I wasn't making friends, and I just did not know where to go from there.
My day-to-day goals are to get through it. That sounds probably crazy, but it's true. It's to get through it.
My long-term goals are to finish my degree finally, to get a better job, and something that I care about and am passionate about. I love the arts, books, music. I'd love to teach. Those are things that I would feel passionate about.
My only definitive long-term goal I've ever set for myself is just to be happy.
I want to work in the mental health field because while having mental health challenges myself, I will be able to be more empathetic and compassionate in other ways other people couldn't who haven't experienced such challenges.
Now, a quick note. This discussion touches on topics that can be triggering for some people. There is help available. So if you or anyone you know is in crisis or thinking about suicide, trained help is available 24/7. You can reach out to the crisis text line. It's 741-741. Text any message to 741-741, and you will connect with a crisis counselor. Or you can talk to someone at the National Suicide Prevention Lifeline by calling 800-273-TALK. That's 800-273-8255. These resources are free, and again, they're available 24/7. Now, you've heard some of the challenges that community college students face just now. Most of jobs, they tend to be older, they tend to be parents, they're often single parents, and they're not wealthy. So let's talk about the group and its challenges. And we have the treat of talking to the U.S. Surgeon General. Dr. Vivek Murthy is an internal medicine doctor. I read he's a big fan of mangoes. His office just issued a rare public advisor on youth and mental health, and his book on loneliness is called Together: The Healing Power of Human Connections in a Sometimes Lonely World. Dr. Murthy, so good to have you. Thank you for joining us tonight.
Well, thank you so much for having me, and thank you for focusing on such an important topic, mental health.
Well, I have a lot of questions for you, but first, I wonder if you have any initial reaction to the brief stories we heard in the video from Beth and Julia and Celine and Sarah.
Well, first of all, it was just, on the one hand, inspiring and heartbreaking to hear their stories, inspiring that they have the courage to speak up and share their experiences, which I know is not easy, especially with so much of the shame that we unfortunately place on mental health conditions that we all often struggle with. But it was also heartbreaking to know that there are so many young people out there who are struggling with depression, with anxiety, with loneliness, with other mental health challenges. I think so often it can be the case that when we are in those moments and we're struggling, it can feel like we're the only ones, partly because of the culture of silence around mental health, but also because there aren't always forums to talk about what we're going through. But I just do want all of them to know, and anyone out there listening who may be struggling, that you are not alone. All of us at points in our life go through challenges with our mental health. Many people are struggling with it right now, especially given the pandemic. And that's partly why I'm so glad that we are having this conversation.
On this topic, your office recently issued an advisory on what your office calls a devastating mental health crisis among the nation's youth and compounded by the pandemic. Now, these advisories are reserved only for top shelf public health issues. And before we get into the stats and the issues that are in this report, I know this topic is personal for you. Can you talk a little bit about why?
Well, Scott, the topic itself is one that is of incredible public health importance, but it's one that I've been touched by as well. As a young person, also later in life, I have struggled with my own mental health at various points. I didn't know how to give words to it when I was younger. I just knew, for example, when I was young, that I was very anxious about going to school. And I knew that part of that was that I was scared about being alone because I felt lonely a lot at school. I was a very shy kid who liked to hang out with other kids, liked to play football and play sports, during PE and recess. But I had a hard time approaching other kids. And the scariest part of the school day was lunchtime for me. When you walk into that cafeteria and wonder, is there going to be anyone to sit next to? And that anxiety was with me, for a lot of my years in school. But Scott, I felt a profound sense of shame about it. Like, even though I was deeply loved by my parents, and I knew that love was unconditional, that I truly belonged when I was at home, I never told my parents, in all those years that I struggled during those years of school, because I just felt ashamed. I felt like I did something wrong. And that, Scott, is what is so common in people's experiences with mental health, is that you struggle and then somehow you end up feeling like you did something wrong, that it's your fault, and that you carry a sense of shame with you. That shame is corrosive, it's destructive, and it actually chips away at your sense of self-esteem, which can make your struggles even tougher. So there's one other experience, Scott, I may share with you, which is
please.
in the experience of bullying that I went through when I was young. And I mentioned this just because bullying is a very, unfortunately, common experience that contributes to the mental health challenges that many young people face. But I remember in middle school itself having a couple of classmates who were sort of relentlessly picked on me because of my cultural background. My family is from India, and of course, my skin color is different from some folks, and my name sounds different, and the food that we ate at home is different. And they sort of found that a point of worthy ridicule. So it became sort of a constant source of shaming, and it really chipped away as a seventh grader at my self-esteem, maybe not want to go to school. And there was a young man in my class, Eric Fong, I'll always remember his name, who one day stepped up, from his seat and strode across the room and said to those two bullies, "I'm not going to let you treat my friend like this anymore." And he shut them up. And I will tell you that I am eternally grateful to Eric Fong, because he probably doesn't know it, but he sort of saved me in that moment and reminds me that each of us, in our own ways, can make a profound difference in the struggles of other people just by showing up, standing up for them, and checking in on them.
Well, kudos to your office for raising this issue. Kudos to you for talking publicly about it. Um, in the advisory, let me just throw out a couple of numbers here that to me were just striking. One is that if you lined up a group of female students in a room, about half in this pandemic would report persistent feelings of sadness. 1 in 6 students would say they have made a suicide plan. 30% of students who have had same sex partners say they have attempted suicide in the past year. I mean, there are a lot of numbers. I don't want to put too many out there, but as you kind of think about the big message of this advisory, what do these findings tell you as a doctor, as a parent?
Well, I'll tell you this, Scott. If you changed the words mental health and substituted diabetes, cancer, heart disease for any of those, we would be alarmed. There would be a national movement to address these for youth populations. Yet, I think we have not reacted with the same sense of urgency that we need to. These numbers speak for themselves. They tell you that mental health challenges are not common and they are not mild. That many of our children and young adults are in a difficult place, not dealing with just temporary sadness, but persistent feelings of hopelessness. The key, though, is also to recognize that mental health conditions, in many cases, are both preventable and treatable. And that should be the goal here, is to see how can we, one, make sure that people have access to treatment, high quality treatment, quick access to treatment, and culturally appropriate treatment. Second, how can we make sure we invest in the prevention programs that we know work, particularly in school and community settings? And the third is, how can we change the culture around mental health? How can we eradicate the terrible stigma that makes people feel ashamed to ask for help, even when their life depends on it?
Very basic question for you, Doctor. What do we know about the important causes, biological, environmental, and what do we not know?
What we know is, Scott, that mental health is a complex product of a whole set of factors in our life. Some of those are genetic factors. Some of those have to do with the family environment that we grow up in. Some of them have to do with the experiences that we go through during life, including experiences of adversity, financial hardship, abuse, trauma, and so on and so forth. And so it's a complex product, and each person reacts differently. Two people exposed to the same trauma may end up in very different places in terms of the outcome. I mention this because it's important we recognize that not everybody follows the same path. And we can't judge somebody else's struggles just through the lens of our own story. We can't say, well, I made it through some hard times, so shouldn't everyone else be able to? Well, everyone is different. Some of us may react less well to circumstances that others may do fine with, and vice versa. So that is really important for us to recognize and understand. But a couple of things that we do know is that when we look at the overall drivers of what is contributing to the alarming statistics on youth mental health right now, I think there are a few factors worth recognizing. One is that many of our young people are struggling with bullying, not just in person, but also online, which is not a phenomenon that we had to deal with, the online bullying 30, 40 years ago. The second is to recognize that loneliness and isolation are actually far more common among young people than we have recognized. And we, I think in many ways, have assumed that young people today are far more connected than people in any other generation. So how could they be lonely? The statistics tell us very much otherwise. In fact, in many studies, young people are experiencing much more loneliness than their older counterparts. And the last couple of things I'll mention, which are important here, is just to think about the impact of technology. When we think about social media in particular, in some ways, social media can be helpful, but there's some individuals for whom the impact of social media can be harmful to their mental health and well-being. We, in some ways, don't fully understand this, and we are conducting, as I think about it, a large national experiment on people throughout society without fully understanding the impact, and that's where we need the companies to step up, provide more data. But finally, keep this in mind. If you step back, Scott, and look at the bigger picture of what a young person is looking at when they think about their future, they're dealing with some pretty profound existential threats, right? You think about the the specter of climate change and how that impacts people's sense of security. You think about the challenges with violence in our communities, with racial discrimination that we still experience in so many quarters. Think about the economic challenges that many families are going through right now. The future for many young people does not feel bright, and that has an impact on their sense of health and well-being.
Well, I want to ask you about a subset, and that is community college students. We know they're not necessarily the same age. They tend to be older on average, so many of them are in their 20s and 30s. But you just described some of the underlying challenges a lot of people have when you talk about economic challenges, right? These are students who tend to have jobs. They may have frontline jobs. They're awfully busy. Many of them are parents. Many of them are single parents. And so for those who have mental health diagnoses, um, they're facing a lot to start out with. And now we have this pandemic, right? Perhaps they can't work the way they used to. Perhaps they have no childcare. They have to do school on Zoom now. So is it time we focus on this population? I hadn't realized that we're talking about half of the college students in the country.
Well, it's a really important point you raised, Scott, and this is actually why I'm so glad we're focused on community college students right now. One, because it is a very large portion of college students. A little under 50% are in fact of college students are in community colleges. But we also know that about 50%, 50% of college students on surveys indicate that they have at least one mental health concern or symptom, which is concerning. The factors you mentioned are really instrumental here. When you are dealing with a great deal of financial stress and insecurity, when you are trying to balance multiple jobs with school and childcare, these stressors, or as I think of them, chronic stressors, because they don't last just for an hour or a day, they last for weeks, months, and years. These can really wear you down and take a toll on your mental health and well-being. And it's why it's so important that we recognize that addressing mental health is more than about making treatment available to people. And it's worth noting also that community college students are, compared to other college students, are less likely to get treatment as it is. So that is a gap that we need to fix and close. But treatment is one part of it. We have to look at these underlying drivers. What are the stressors in people's lives that are contributing to a sense of not being well, that are wearing down their ability to stay in the mental state and the state of well-being that all of us ultimately want to be in. And that's where, thinking about, financial aid and debt relief becomes so important. It's why thinking about how we support students with some of their needs outside of school are so important. Childcare, gosh, I say this as a parent of two young children. Childcare is an incredibly stressful source of great stress for so many families, especially during the pandemic. When I was when the pandemic started, we effectively, my wife and I, we lost our childcare, and we were fortunate to be in a privileged position where we could move and go closer to my parents, and they were able to help us out a lot with childcare. But even with that help, it was stressful. I recognize for many people that was not an option. So the pandemic has deepened, I think, the stress that many people have experienced, and also deepened the loneliness that people have experienced because many people were not able to be with the folks that they loved, the friends who often comforted them during these difficult times.
And, the community colleges, as we know in general, are economically kind of scraping to rub a couple nickels together just to keep going. When you think about, I guess, the big pieces of a solution, of a response, whether it is public policy or otherwise, for community colleges, what's at the top of your list?
Well, first, I want to say that community colleges themselves, the environment itself, can be an extraordinarily powerful asset when it comes to improving and addressing mental health. And for a couple of reasons. One is the more we're able to build in counselors that are available to students and actual integrate treatment options for students, the more we make it easier for them to get the help they need. And it's not so easy sometimes to find that help in the community. But the second reason is that we know that social connection and having a sense of community and belonging are incredibly powerful when it comes to being a buffer against the stressors that people experience in the rest of their life. And to the extent that we can intentionally cultivate that sense of community in our educational institutions, it doesn't just happen by having happy hours and throwing people in a room together and hoping that they bond over ice cream, or drinks. You have to intentionally design activities that foster connection. Something that we did in my office when I was Surgeon General, something we continue to do now. But that's also incredibly important. One last thing I'll mention is that we have good evidence that social and emotional learning programs and other school-based programs can be very powerful at equipping young people with a foundation for building healthy relationships, for dealing with the difficult emotions as they arise, and they inevitably will arise. And even though those programs are typically studied and designed in younger age groups, we do have college-based programs as well that can be very helpful here. In fact, we detailed many of these programs in a Surgeon General's report I did a few years ago. So the bottom line is community colleges can be incredibly important forces for strengthening mental health from both a prevention, treatment, and community perspective.
Well, Dr. Murthy, we have an opportunity to have you interact with a couple of our community college students who have agreed to join us. So we really appreciate your staying on for this next conversation. First of all, for those who are in our audience throughout this discussion, we would like to hear from you. So if you have a question or a comment for our guests, you can use the Zoom Q&A, or if you're watching on Facebook Live, please leave a question in the comments section, and we'll get to as many questions and comments as we can. When you post, please let us know your name, your age, and your city. Now let's introduce Celine Mendoza. She just graduated from Northern Essex Community College in Massachusetts. Hi, Celine. And we have Julia Vogel. She's a student at Bunker Hill Community College in Massachusetts, who you also heard in the video earlier. Celine, can I start with you? Do you have a question or an observation for Dr. Murthy?
Yeah, I saw that he took a class, an elective at Harvard, at the Healer's Art. Do you think one of those classes would do really well for those in community college, more implementing some of those?
Well, Celine, wow, I'm really surprised that you know about that. So the Healer's Art was a wonderful course that I had the chance to be a part of and to help build out at when I was in medical school. And the key idea behind the class was to create an opportunity for students to reconnect with the core values that brought them to school, that brought them, in that case, to the medical profession. And I actually think there is applicability of a course like that well beyond medical school to all educational institutions. Because whenever we go through a journey, whether that's a new job or a new educational experience, it can in some ways throw us for a loop. Sometimes we can lose our bearings. Sometimes we may have to deal with a lot of adversity once we get there. And all of us need to be re-anchored from time to time, to be reminded why we do what we do, why we're there. But the other key piece of it, and this is what critical to the Healer's Art, was it fostered authentic connections between the people who participated. By sharing openly and honestly with one another, we forged these extraordinary bonds. And whenever we would see each other after that class, in the hospital, when we were on rotations or in the classroom, we would just look at the other person and know, okay, we know who they are, they know who we are, and we feel a sense of comfort and community because we had shared openly and honestly and authentically. Spaces like that, creating spaces like that is absolutely invaluable. I'll tell you right now, in the office of the Surgeon General, Celine, we do something like this also. We have something called our Humans of OSG. OSG stands for the Office of the Surgeon General. And what we do is we take two people each week and we have them interview each other and ask questions just about the person's life, about what drives them, what they're passionate about, what worries them, what are their fears. And we've created a culture where people know that's a safe space where they can share. And I'll tell you, the bonds that it has fostered have been wonderful, especially even in a virtual environment where people are not always as able to see each other in person.
Wow, thank you.
Well, Dr. Murthy, I correct me if I'm wrong. I think I also read that perhaps it was when you were at Harvard, or perhaps in this current job, where in these team meetings, perhaps on Zoom, you would ask individuals to spend a few minutes at the top of the meeting introducing themselves through some slides so they can kind of talk about themselves, and suddenly you have so much more of a community on your team, as it were.
We did, Scott. It was actually a very interesting experience because this was something we did when I was Surgeon General during the Obama administration. But we had tried, having happy hours, having weekend picnics, and those took a lot of effort to organize, and people didn't always get to know each other well. So we thought, let's try something different. So we did something that took a lot less time, a lot less money, but actually had a much better results, which is at the beginning of our weekly meetings, we just took 5 minutes and we asked one person, a different person each week, to bring in pictures. And it could be pictures about anything as long as it wasn't work. It could be a hobby, a passion, their family. And then they would just show us the pictures and they would talk about them. And we learned such extraordinary things about people through that simple exercise. I'll tell you one a young man who was in our office, who was my aide de camp. He had served in the Marine Corps prior to joining the Public Health Service. And everyone expected him to come in and share pictures of his time in the Marine Corps. But instead, he showed pictures of his mother and his father. And he talked about how in his father, who had since passed away, he saw the musical talent, the beautiful musical talent that had filled his childhood now live on in his own children every time they picked up a guitar. He talked about his mother and how he was an incredible source of strength for him, especially at times of great danger when he was serving in the Marine Corps. And so these are powerful experiences. Yeah, really.
Yeah, I'm sorry. I just want to give Julia an opportunity. Julia, do you have something to say or ask of Dr. Murthy?
Yeah. How can we make individuals with disabilities become more successful with completing college? I myself am struggling and sometimes contemplate dropping out even though I almost finished. And the other one is, can we make study guides mandatory to be given to students in preparations for quizzes and exams? Sometimes it feels like they want us to memorize the entire book, and people with disabilities have limitations on how much they can actually memorize. And people can go into specialties where they don't need to memorize everything in the entire book.
Well, Julie, thank you so much for that question. It is so important that we make sure that the needs of those who are differently abled are met when it comes to educational needs, and really, frankly, throughout society. I think that starts with making sure that we have a constant way to listen and understand what those needs are, and whether the services that are available on an college campus are in fact meeting those needs. Because even with the best of intentions, there can be gaps that arise, and these need to be student-centric. The second thing I think we need to do is to recognize that some people have physical disabilities, others have other types of disabilities that require different attention. And the third, I think, is to recognize that here too, when needs aren't being met, I don't need to tell you this. I know that you and others have experienced this, but whatever your disability is, it can be isolating. When those needs aren't met, and when you're not able to access the same opportunities and resources as other people. And that there too, I think community is so important, and fostering that sense of community among students who may be facing similar challenges is, I think, yet another important resource that communities and community colleges can help provide.
That reminds me of a quote from Robin Williams. He said that the worst feeling in the world isn't feeling alone, it's being around people that make you feel alone. And then for young people, there's a huge urgency of needing love and belonging, and sometimes that overrides their mind, and they wind up having toxic friendships and start getting bullied by friends, and bullying has gotten way higher, and it's much more prevalent, and it's crazy. It seems some of the bullying is scary. Call people horrible names, fun around on campus. People would even get assaulted in school.
Yeah, sorry, Julia, your internet connection is a little bit spotty, but no, thanks for the anecdote. With the minute or so we have left, Dr. Murthy, any kind of concluding thoughts or anything you'd like to say to our students before we move on?
Well, I just want to say first, thank you for the opportunity to have this conversation. To all the students out there who are listening, who may have struggled or may be struggling right now with your mental health, I want you to know that you are not alone, that there are others who are struggling as well, but there are people who have your back and want to be supportive, who want to help. I also want you to know that there's nothing wrong in asking for help. I know it can feel lonely and sometimes shameful to struggle with your mental health and well-being. But as somebody who's gone through those struggles, both as a child and later on as an adult, I can tell you that there is no shame in asking for help. And finally, just remember that reaching out to others who are your classmates and checking on them is always a good thing to do. You can't always tell who's struggling from the outside. And those small acts of service end up making us feel better as well. So thank you for your attention to this topic. We've got a long way to go as a nation to get better in terms of how we approach mental health, but I'm confident and committed that we can do this and that we can make progress.
Well, Dr. Murthy, thank you so much for taking a lot of your time to join this important panel. It has been a treat to have you. So thank you so much for your efforts, for your advisory, for bringing attention to this issue, and for your time.
Well,
And we
thank you
also
so
want to
much,
say
Scott.
thank you. Of course, yes. And Celine and Julia, you've shared a lot of time with us and a lot of your stories. So we really appreciate your helping us to put a face on this challenge and being brave in public to share your stories with all of us. So um, well done to you and to your work, and thank you for joining us tonight as well. Much appreciated. And coming up, we have two experts in the field of mental health and community college students. But first, we want to share a preview of a new film from producer Ken Burns. It's called Hiding in Plain Sight, and it's coming to PBS in 2022. This film shares the experiences of young people living with mental health conditions and the experiences of the people around them.
I think there's so many things you can say about mental illness. It comes out of nowhere, and then it just creeps into your body, and you don't know how to deal with it.
It's a strange thing to look back on and think to myself, I really didn't care about anything at that point. Not caring if I wake up.
It became a very frustrating thing whenever I'd look in the mirror and there's nothing wrong with me on the outside. There's absolutely nothing wrong to make sense of that pain.
That moment that nothing else mattered to me, that I just threw myself in front of a moving car.
I told my parents what would happen if I wasn't here.
I still had a whole future that I had planned, it's like I was planning the suicide, but at the same time, I was making plans to go out to the movies with my friends the next week.
It's hard to endure, but it's just, take it one day at a time. And that's kind of how I've been living my life.
It affects my daily life all day, every day.
When I finally did start to think oh, I'm probably an addict, I was like, no, you're just lying to yourself.
I really want to live, and I'm trying to make the effort, and I want to have a good life. Maybe 1, 2 kids, not the white picket fence, but something that's livable, not this, but I want it. And I just want normal and mundane and average. Maybe a trip to Myrtle Beach every summer. I don't care. I'm sick of crazy, chaotic, up and down mess.
There really is light. There really is. I know you're you don't know me. You have no idea of my journey. You have no idea. You're right, I don't. You're right, I don't. But I do know about lots of other kids' journeys. They are very different than yours, I'm sure of that. But what I know is that you're worth it. You have value. You are fighting this fight that you truly have no idea whether you're going to win or not. You're beyond courageous. You're beyond courageous. And you're stronger than you know. So keep the fight. Stay strong in your resolve, because you're worth it.
And welcome back to Call to Mind Live Pass or Fail Mental Health in Community Colleges. I'm Scott Tong. I'm co host of Here and Now from NPR and WBUR Boston. Thanks so much for joining us. And as a reminder to everyone joining us online, we'd love to hear from you during the discussion. So add your comments, your questions, and your stories in the Zoom Q&A if you're in Zoom, or in the Facebook comments section if you're joining us that way. And when you post, please let us know your name and age and where you live. And joining us now is Dr. Alexander Tai. He's a board-certified psychiatrist at Massachusetts General Hospital, and he's associate professor of psychiatry at Harvard Medical School. He studies large-scale social forces and their effect on mental health. Dr. Tai, thanks for joining us.
Thanks for having me, Scott.
And we also have Jordan Herrera. She's the director of social services at Amarillo College. That's a community college in Texas. Jordan, welcome to you.
Thank you.
And let's continue this conversation about mental health issues in America and how they interact with the pandemic and the unique challenges facing students in community college. Jordan Herrera, can I start with you? Can you tell us a little bit about the profile of a student at Amarillo College and recently, what are the important mental health challenges you've seen there?
Yeah, definitely. So the students at Amarillo College, they look a lot like the students that we've kind of been talking about during this program. They are students that are working and trying to go to school and trying to balance a family life, all while trying to maintain, their own mental health and trying to show up every day and be their best version of themselves in whatever capacity of their life. A lot of the students here at Amarillo College are working. They have families. A lot of them are in situations where they are struggling financially. Over 75% of the students at Amarillo College are Pell eligible. So we do know that they are having some financial struggles, and we understand that, finances can bring about a lot of different stressors upon someone's life. Again, like I mentioned, we're dealing with students who are adults who are, here to better themselves. They are not necessarily right out of high school. So they're not necessarily in the age range of 17 to 18 years old or even 19. We have students who are well into their 30s and 40s. And so when we work with the students here at AC, we are really working to support them, but also support the family unit that they have in the house. I think it's really important for them to know that at the college that they attend, we look at them and we want to not only help them, but help their family and try to make things easier for them so that way that can be obtainable for them.
And in this pandemic, what mental health challenges have really kind of risen to the forefront as far as what do you see?
Yeah, we've seen a lot of students just really dealing with anxiety, dealing with the depression that is coming with being isolated, the stress that's coming with living through this pandemic, just the uncertainty that they are going through, that we're all going through because we're all living this in this moment. But for them who may already be on a very thin sheet of ice, to just have, that normalcy taken away from them has really unfortunately put a lot of students in really delicate situations where they've had to reach out and get the help that they need, which is what we want them to do. But unfortunately, it's been hard to sit back and watch life get harder, I guess is the best way that I can say it, than it already was due to these circumstances that we don't have any control over.
Yeah. And Alex Tai, let's bring you into the conversation now. These challenges that Jordan Herrera in Texas has told us about, do those overlap with what you're seeing on the front lines at Mass General Hospital?
Yeah, I mean, I would say whether we're actually experiencing higher patient volumes and higher acuity is probably a little bit above my pay grade, but anecdotally, I would certainly say it feels busier. The clinicians in the department, we get these emails from the departmental leadership periodically saying, hey, the psych ER is a little too crowded right now, so please stop sending your patients directly to the ER for issues that are not truly emergencies. Please work with us. And meanwhile, the hospital also sends us these emails where the subject line is just alarming. It says, the hospital is at capacity disaster. And I always cringe whenever I see that email. But, we got those emails yesterday, we got them the day before, we got them Friday, Thursday. So at some point you kind of tune it out, and we're running out of N95. So, I mean, we're always packed to the gills, but it definitely feels like we're busier.
Yeah, and as far as some of these challenges we've been talking about this evening, in the pandemic, in some cases increased anxiety, challenges with loneliness. I mean, are you hearing that day to day yourself?
Yes, definitely. I think, I mean, we knew that the mental health burden among community college students was already greater pre-pandemic. You know, in some of the large scale studies that have been done, you know, 1 in 3 students will screen positive for significant depression or anxiety. Maybe 1 in 4 will screen positive for an eating disorder. And all that has just gotten exacerbated with all of the economic and social problems that have occurred during the pandemic.
Yeah, and you know, for these community college students, Dr. Tsai, often in their 20s and 30s, economic anxiety, as we talked about, is often part of this picture. You've studied job insecurity in this pandemic. How does that factor into all this?
Yeah, well, I mean, if you followed the rules, you were supposed to actually do okay. One of the rules was you go to college, you get a job, you have a family, you get a house, and you were supposed to be okay. But you know, really, that hasn't panned out for a lot of people. Some people sort of worse off than others in terms of the job insecurity, in terms of the debt. That they've incurred from college. That's actually one of the great things about community college is that it's actually less expensive compared with four-year college degrees, and the return on investment is actually in many cases a lot greater. But still, people who go to community colleges tend, as you discussed earlier in the show, tend to be from households that are on the lower end of the income distribution, so who have also been more adversely affected by the pandemic. So yes, certainly job insecurity, insecurity from housing, evictions, and so forth have all sort of essentially conspired to undermine population health in this community.
Mm. And a question for both of you, maybe first to you, Jordan. As far as services and solutions and the role of the government, how do you see public policy and the role of government, you know, trying to tackle this challenge that, as you've both described, is more of a challenge than ever in this pandemic?
Yeah, well, I think when I think about that, one of the things that just in my experience during this pandemic and working at the community college, having access to stimulus funds to bring relief to the students that, you know, we are serving, we have actually been able to provide additional financial supports to the students that we have had here at Amarillo College since this began, and that's been wonderful. But I think just with my own professional judgment towards it, and the work that I see and the students that we work with directly here in the ARC, that financial support has been wonderful, but it almost is not enough to go towards the damages that have been caused with job loss and, you know, the financial strains that come along with, you know, even losing family members due to this pandemic and losing, you know, that other set of financial supports. And so I think that the efforts have been, they're there, and they've been appreciated, but I think we're going to have to really look outside the box and see what else we're going to do, because this is something that's probably not going to go away for a while, and until we can really get everybody's feet back on the ground, and where we can safely move forward and kind of resume to normal. I look at the financial stressors of everything, for especially our students that were already in very delicate situations. That those supports have been wonderful, but what else can be provided to them during this time?
Yeah. And Alex Ty, in your view, how well or not well has the government performed in this pandemic on the mental health side?
I think one of the difficulties is with asking college administrators and asking clinicians and health systems to address the issue is you kind of trying to ask them to bail out a leaky rowboat with the spoon, and you know, it's a really heavy lift in terms of trying to do things about evictions and food insecurity and lack of health insurance coverage and all these things. I mean, the list goes on. I mean, that being said, I do think there are things that can be done. Certainly, clinicians and public health practitioners can collaborate, I would say, with campus administrators to essentially increase, I would say, the supportiveness of the campus environment. There was a recent study of 40,000 community college students that was led by RAND Corporation, and they found that only 1 in 5 students reported seeking treatment for mental health difficulties. But interestingly, one of the strongest predictors of seeking treatment was feeling that like the campus environment was supportive of mental wellness. And if you believed that, you were 60% more likely to seek treatment. And several other studies have also shown this. And so here, I think the Air Force model is actually pretty instructive. In the 1990s, the Air Force was experiencing a very alarming increase in the suicide rates, and they responded by developing a suicide prevention program that was very successful and involved sustained commitment from Air Force leaders, ongoing and very regular communication about suicide, destigmatization, and training peer-to-peer referral agents. And everybody was involved. Essentially, it was a model of cultural change, and it worked.
Yeah. Great. Well, let's go to some questions from our audience here. Joining us from Zoom is Morgan. Morgan is 44 years old and joining us from Chicago. And Morgan's question is, I'm a community college faculty member. What other ways can faculty, often the front line for student support, be supportive? We are definitely seeing the mental health crisis in our classrooms. Jordan, to you first.
Yeah, that's a great question. So I just think that if your institution has resources available to your students, making yourself aware of what those are. If you have a counseling center, having that information available to provide to students. At Amarillo College, we have our Advocacy and Resource Center, and myself and 2 others are social workers
is that
here.
the ARC? As a couple moments ago, you mentioned ARC. That's what you mean, the Advocacy and Resource Center? Okay, thank you.
Yes, sir. Yes. So we are we're social workers, and so one of the things that our president, Dr. Lowry Hart, has kind of his message around our whole campus has been, you don't have to be the social worker, whether you are the faculty member or a staff member. You just need to have the ability to refer over to the Advocacy and Resource Center to have the students meet with us and connect, and we would then at that point connect them to those appropriate resources. But I would say, I know that that's not always an option for every community college, having something similar to an Advocacy and Resource Center or even a social worker on their campus. So I would say being able to know what those resources are and being able to advocate for that student that comes forward in your classroom and may need that extra help, because the way that I see it here at Amarillo College, this is not just one department's job. This is our whole job. That we have a culture of caring at Amarillo College. So it is all of our duty to ensure that the students are being connected appropriately to the right resources. And so just being an advocate, just being able to listen to that student and empathize and show that you really care is a big step in the right direction.
Great. Alex, Ty, any thoughts as far as what faculty members can do to be more supportive?
Yeah, I think everything Jordan said was totally spot on. I mean, it kind of goes to what I was saying earlier about peer-to-peer referral agents. Individual faculty members might not be the ones who are sort of providing social work services or, providing one-on-one counseling to students, but certainly if they have mental health literacy or the campus can help them develop better mental health literacy, they can identify mental health problems among students in their classrooms and they can refer them to services. They can, in general, provide sort of be a center. A centering point for destigmatization and having conversations with students and stuff like that, so that students who are experiencing difficulties can get referred to appropriate treatment.
All right, we have a question from Chimamaka from Massachusetts. And the question is, how do you suggest preparing for the toll college can have on students' mental health? How do you suggest preparing for the toll college can have on students' mental health? Start with you, Alex.
I would say that one of the things that I would say is probably most important is something that Dr. Murthy touched on earlier about social connections, because there's a lot of very strong evidence that social connections and social integration and social participation can effectively buffer you against the adverse mental health effects of these stressors, including food insecurity or including loneliness or financial insecurity and things like that. And so trying to develop those networks and trying to kind of be in community with other people. And, I think there's that's one of the most important things. For people who are about to head off to college or who are just starting out, I think, finding your friends and finding your support networks and being present to other people and learning how to do that together, I think is really, really important.
Yeah. Jordan?
Yeah, I would agree with Alex. I think that it's just important to know that network, know those resources. If you're not able to provide those direct services on the campus, be aware of who can provide them. Invite agencies and community partners that can help you move forward and help students know that they are going to be cared for holistically while they are there at your institution. And I think also just I look at our students, and this is something I always tell my own students when they come in and they're visiting with us in the Advocacy and Resource Center. College was never supposed to, be this easy thing. I think it goes back to the comments from earlier. You think, oh, college is it. You go in, you do what you need to do, and like you just keep checking the boxes, and then life is just going to magically do what it needs to do, and you're going to progress onto the next level just so easily. And that's just not how it happens, because life is life, and things will happen. And so I just think that for our own students here and students across the nation and in college as a whole, we just have to remember that progress over perfection is what we have to aim for. You're showing up, you're coming to class. It is difficult, but you know what? Get yourself prepared. Know who are your advocates on your campus. Know what resources you may need. Even if you don't ever have to access all of those resources, just be aware, educate yourself, and don't be afraid to ask for help, because that is the number one thing that I think kind of terrifies a lot of people, is just, I don't want to be the one to have to ask. It's okay if your college is moving towards a culture where they care and they want to show you that they are investing in you in every aspect of your life. Don't be afraid to ask for help, because that is what we are all here to do, is to help you. So just prepare yourself, educate yourself. Progress over perfection definitely is the thing I always think about.
Well, speaking of asking for help, I have a broad question for both of you, just on communicating, talking about this challenge, whether it is a student, whether it's people in that student's lives, to be able to talk about it. Dr. Murthy started us off talking about shame, which is such a powerful force in society. There's been a lot of talk of bringing these mental health challenges out of the shadows. And in my own family, I have close family members with mental health diagnoses, and we tiptoe around it. We either don't talk about it or we don't know how to talk about it. And we know there are people, even in my family, who are dubious that these diagnoses are actually a thing. So help us out. Jordan, starting with you, what advice can you share about how all of us can talk about this, can do better jobs just talking about this?
I think it starts with creating an environment where people can feel comfortable and welcomed, and just already feel that presence of, I am seen. I'm a human first, and I have needs, and I have maybe struggles that are going on, but I am being seen for who I am. So I think just creating that environment where somebody can feel open enough to share these struggles and have these conversations, especially if you are a person who's been positioned to advocate for these students. Especially sometimes I think that kind of happens to people just because people can sense their energy and their spirit, and so you allow them to feel comfortable enough to share. And so I think it's just welcoming them, providing that environment, and then being empathetic with them. And maybe you don't know what it's like to walk in their shoes, and you may not have experienced that, and that is okay. You are still capable of helping somebody obtain the right services and resources that they need to be their best self. All it takes is just being an empathetic person and having that compassion towards them to connect them to the right services. But I think it just starts with what kind of environment you create, and truly listening to a person when they come to you, and not just immediately trying to just shoot them down and answer a question and move on. Be there, be present, and really open yourself to those conversations.
Alex, Ty, your advice on how we can all be better at talking about this?
Scott, I think this is such an important conversation to have. I am not a stranger to kind of some of the themes that you just mentioned just now. I remember I don't know, this is either a couple months ago or maybe a year ago, Boston Mayor Michelle Wu wrote an op-ed in the Boston Globe about her family's experience with mental illness, and I thought, wow, this is what I needed to read. And so I just, dashed off this fanboy email and said, hey, I'm a Taiwanese psychiatrist in Boston. I really appreciated what you wrote. This is amazing. But, I think that having these conversations and bringing it out, I think, especially in cultures that essentially do not believe in mental illness, is really important. Whenever I have these types of conversations, one of the things I try to keep in mind is that it's really important to convey to the person that you have a relationship with them and that you are there for them, even if you don't agree, even if they express either hurtful opinions or express disbelief about the work that you do, or whatever issue we're talking about. But to express to that person, look, we're in a relationship. I mean, I don't know if I would say it in such a cheesy way, but like, we're in a relationship and I really value you, and we're having this conversation because it's really important for me to understand like where you're coming from and why you believe what you do.
Yeah. That is Alex Tsai. He is I'm sorry. Before I say goodbye, we have one more question I would love to run by you, and it is from Gail. She's joining us from Somerville, Massachusetts. What about building in mentors for these students in community college? A trauma-informed response is to build and expand trusting relationships. Dr. Tsai, you just talked about that. Given that so many of these students have adverse childhood experiences, this would be an important addition to community college. Concept of mentors. Alex, you first.
Totally agree. I think if I had to reflect on some of the most developmentally important points in my life, both sort of personally as well as professionally, I would say it's been mentors. Even I don't know, as far as recently as like say 2 years ago, one of my research mentors who's now in Oregon, just so important. And I think most of the time, people who do any kind of mentoring work actually don't understand how important they can be in the life of somebody else. And maybe, I don't know, maybe they finally understand it 10 years later or something like that. But I think it's so important, and it's such a wonderful suggestion.
And Jordan Herrera on mentors?
Yeah. I totally agree. One of the things that we've learned, just even through the work that we've done at Amarillo College and focusing on poverty and the effects that that has on a person, relationships are one of the main things that our Dr. Donna Beagle has taught us ourselves, building those relationships. And I think about mentorship alongside with relationships. You have a person who can help you, who knows a system that maybe you don't understand, who you can call and or text or email and just say, hey, can you explain this to me, or can you show me this and guide me, and just be that person for them in case they need you. But I think that there's so much power in building a relationship that would allow somebody to understand and have a better level of confidence after they've completed their education at a community college, at their education at a university, because now they feel more confident in knowing a system that maybe they were not familiar with, especially for our first generation students. This can be a terrifying world, especially knowing that they don't really have anybody within their own household unit that they can ask questions about. And so I believe in the power of mentorship for sure. And that is something that we've done here at Amarillo College, as well as provide that, because we, again, just know that when this is an unknown world, you need every tool in your toolbox to just help you. And a mentor is probably the biggest tool that you could have.
Yeah, well, Jordan, that just reminds me of one of the community college students I talked to. She was a first generation college student in her family trying to do school on Zoom. Her family was around her, but she felt so lonely because she said, they don't understand what I'm trying to do here, right? They want me to continue life and to continue working, and who understands what I'm doing? Wonderful discussion. Jordan Herrera is Director of Social Services at Amarillo College in Texas. Thank you so much for the time.
Thank you so much. This has been my pleasure.
And Alex Tai is a board-certified psychiatrist at Massachusetts General Hospital and an associate professor of psychiatry at Harvard Medical School. Dr. Tai, thank you so much.
Thanks so much for highlighting this issue.
And this has been Call to Mind Live, Pass or Fail, Mental Health in Community Colleges. This is a special program co-produced by WBUR and Call to Mind, and that's the American Public Media Initiative to foster new conversations about mental health. Our event is supported by the PBS NewsHour Student Reporting Labs and by the Wellbeings Tour, a national public media initiative and TV station WETA. You can find resources to support youth mental health in our Wellbeings Toolkit. Go to calltomind.org, wellbeings.org, or wbur.org/events to find more information. And please stick around for a few final messages from our partners, including a great conversation with Dr. Pam Edinger. She's president of Bunker Hill Community College, about the role housing and food insecurity play in community college student mental health. So please keep watching, please streaming for a few minutes, and we hope you can participate in a brief event survey and let us know how to make future events even better. Thank you for joining tonight. I'm Scott Tong.
Hi, I'm Lourdes Bullo, a journalist with the PBS NewsHour Student Reporting Labs. I'd like to welcome Dr. Pam Edinger, the president of Bunker Hill Community College in Massachusetts. Dr. Edinger has been a part of the community college movement for over 25 years. Do you think you could talk about the issue regarding housing insecurity and the homelessness problem among community college students?
Of course. A survey was done nationally by the Government Accountability Office, which is a nonpartisan quasi-governmental agency in Washington, D.C. So they surveyed across the nation, particularly in community colleges, but also in post-secondary institutions that are not community colleges. And for Bunker Hill, our numbers really benchmark the national findings. About 54% of our students are food insecure, which means over the last 30 days, they had to make choices between food and something else, right? Food or rent, food or buying books, food or traveling to school. And because community colleges educate about 50% of all the undergraduates in the United States, those numbers can be staggering. And 14% of our students are homeless, which means they're couch surfing, or they're in shelters, or they're in cars. It is an issue that has always been very much hidden. There's always the ongoing joke of, well, if folks are hungry, they can eat ramen, right? Or, yeah, well, they're not really homeless if they have somebody's couch to live on. But when you think about what makes a student successful in the classroom, those basic needs, and that's the way we're calling it, those basic needs are key. Because without shelter that is stable, without a decent meal, how do you study, right? How do you form a community to study and to think about the future? You can't.
When you were talking about food insecurity, how do the everyday challenges of food insecurity impact the mental health of community college students, and how do we work towards changing it?
So there's a certain complexity, I think, that resides with a community college student, because our students tend to be older. Our average age is 27, 28, right? Whereas when folks normally think about college students, they're thinking 17 to 21, right? If they get in trouble, they go home and they call mom and dad, or they get something, sent to their bank account. Our students, three out of five are parents. And half of those parents are single moms. So when you think about the struggles that they have in not having enough food or not having shelter, it's not just their problem, it's a family problem. So the momentary anguish or depression that a young person who is between 17 and 21 may suffer is compounded by the family situations or the community situations that community college students are embedded in, right? They're enmeshed in more than just their own survival or just school. And when you think about not having food and shelter and their family not having food and shelter, depression and stresses and wanting to go back to school, wanting to do well in school, it is a huge burden. And it's really a lot of times up to the colleges to be ready and to understand that we're part of the solution, right? If we don't put solutions on the table, then we're part of the problem. And I think as institutions of higher education, the institution itself needs to learn how to be self-reflective. That as a college, we need to constantly ask, are we student ready? Are we ready for our students? And not to ask, are the students ready for us? Right? That's the wrong question. So in terms of basic needs, we do have an emergency office called Single Stop. So, and we also have a food pantry. So students can, and it's kind of like our version of Peapod, right? So they have an app on their phone that our students would order the food that they need, which includes things like feminine products and baby products. Because our students are parents, right? And all young women are going to need feminine products. So they order it on their phone and we package it up. And they used to come to campus to pick it up. But because we're in the middle of the pandemic, we partnered with another nonprofit organization. They deliver these groceries to the houses of our students. And all of our students are within 10 miles of campus because we're a community. So at least I know that that students will eat that week. And also on the longer term, we're trying to change policy, federal policy, so that students will have greater access to things like SNAP, which is the Supplemental Nutrition Program. They used to call it food stamps, but that's really what it is. And other kinds of policies that needs to change, right? You can't things that makes people happy, like food pantries or referral to housing, are really good things, but they're temporary, right? They're patches, and we can't food pantry our way out of poverty. So we have to change policy, right? So in order to get that to work, and folks like you who are messaging agents to the world, it is the narrative that you're changing about food insecurity, about mental health, is what we're going to need to tell the story differently. The fact that you and I can talk about therapy openly, you and I can talk about mental health, it's really important. And I really do hope that will change how we bring the next generation to success.
I just want to say thank you so much, Dr. Ettinger, for sharing your expertise with us today.